Welcome back, everyone, to Morning Line. Nick Barris here this morning talking, as you see on the screen, medical malpractice. The number's up on the screen. You know Clint Kelly. He comes on every month. He's a malpractice attorney here in town. His office there in Hendersonville. Good to have you on, as always. Nice to see you, Clint. And also with us, Kathy Farrell. She's a registered nurse. She's the one that oftentimes when you call his office, you'll talk to, kind of will ask you the questions and get a feel for whether or not you legitimately have a case, and then she gets with Clint. So thought it'd be nice to put a face to the voice. How about that? Nice to have you on. Let's take a call for you. We've got the lines open, questions or comments, and we'll start off here with Robert. Robert, good morning.
Good morning, Nick.
Hey, Robert, what can we do for you, my friend?
Well, I've got a question. My mother was in a long-term care facility, and she was a fall risk, and they had a bed alarm on her bed in case she gets out. Well, on September the 9th, they carried her to the bathroom, and the tech left her alone in the bathroom. And while she left her alone, she fell. And so they called me and told me that she fell, and the doctor had checked her, and she had not had any fractures and didn't say she had any injury. So the next morning, one of my brothers went by to check on her to see her and found out that in this fall, she had hung her foot and tore a toenail off. And I went up there, he called me and asked me if I know about it. I said, no, they didn't tell me she had any injury. And so I went up there that afternoon, on Saturday afternoon, and found out that she had pulled this toenail off. So I went in the bathroom, looked around to see there's nothing in there that she could have hung her toe on except for a wheelchair. And they left her wheelchair in there as the tech did as she left. She tore this toenail off, and it got infected. And then on the Tuesday of the following week, they called me and said that we may have to carry her to the hospital. Well, I told them, and they talked about her toe hurting her and giving her a lot of trouble. So they called me back in about an hour and a half after that and said she was having chest pains. And so thought she was having a heart attack. So I told them I'd meet them at the emergency room at the hospital. They carried her to the emergency room at the hospital. She was having a heart attack. And they run tests on her and found out this infection was MRSA. And her doctor said that the MRSA is what caused her to have the heart attack. And she passed away on the 17th.
Oh, I'm sorry. I'm sorry. Wow.
My question is there a case there of neglect on their part? Because they didn't do a thing, from what I could tell. My brother went up there on a Saturday, and they had not even cleaned this toe up. And I know what happened is that she found her, got her foot. She didn't have good circulation in her feet, so she didn't have feelings. So I'm sure she got her foot hung in that wheelchair somewhere or another to pull that toenail off, because it was nothing else in that bathroom that she could have hung her foot on to tear that toenail off with. And it just it set up infection and
then one thing after the other. At first I was going to say toenail, okay, and we talk about damages and how it goes, but then the ultimate result, which is so sad. I'm so sorry he lost his mother this way.
Yes.
What do you think, Clint? I mean, stay on the line if they have a question for you, but how do you triage this? You get a call like this.
I think the first place to start is with Kathy and asking Kathy to explain to our audience what is meant by fall risk and why that's important in a long-term care facility, or frankly any facility.
Well, most of our elderly can be fall risk, and certainly if she was taken to the bathroom with a wheelchair and not ambulated with a walker or with several people to assist her, then the facility knew that she was a fall risk. It may be due to her age, it could be by other medical conditions, that she would get weak or that she would get dizzy when she would get up. Certainly, if she didn't have any feeling in her feet, she was a fall risk, because she can't feel where she puts her foot down. And she doesn't know when she's got the weight on her feet. So it's very dangerous, and we stressed our nurses, we do not carry someone into the bathroom and leave them unattended. Often they forget that there's no one there to help them, and they try to get up themselves, and then they do fall. So one thing is that we don't want you to be left unattended in the bathroom. So that would be something that is a fall risk. We don't give you the opportunity to fall by getting you up and then leaving you unmonitored or unattended. And so, it could be very valid that she could have fallen and hung her toe or toenail onto the wheelchair, the spoke of the wheelchair, and it could have ripped off the nail. And MRSA, or MRSA, or methicillin-resistant bacteria do reside in hospitals and nursing homes. It's usually where that's found. It is in the broader public, in the general public, or in our environment, but because of the illnesses that are within a facility, that's where it breeds most time.
Well,
and
what
so
about
we
then-
do have a hard time with having MRSA to be communicated and carried around.
So it's not just that maybe she wasn't watched alone, that being it. I mean, also I wonder about the aftercare. And he said that it didn't seem like they did much for her, didn't clean it or whatever, and then it gets infected. So I guess the question for you is, you get this call, does he have a case or not?
I think he may have a case.
What do you think, Clint?
I do. What I'd like him to do is have him call my office at 615-824-3703. And Robert, when you call, ask to speak to Nurse Farrell, and she can get more information from you, and then she'll provide that information to me, and I'll make a judgment as to whether or not I believe the case warrants further investigation or whether I need to go get a medical expert. But that's how this process works. You get the analysis that you just heard from Kathy, and then she'll provide that analysis to me once she gets more information, and then I can make a judgment on the case.
Robert, you still there?
Yes, sir.
Listen, what I'll do is just stick around, and we will have the number up on the screen here in a few moments or so, and you can write that down, contact. And again, I'm sorry for your loss, but I'm glad you called, because it's definitely worth looking into. And so much of sometimes these cases, like yours, the reason you have attorneys like this who can follow up, it's not just to get relief for the family, but hopefully if there's an issue in this nursing home, it gets corrected after you guys hold them accountable.
Yeah, or get the family an
Because you don't want to
answer.
see it happen to someone else.
Getting the family an answer is as important, I believe, as even taking the case, if you choose to, because families a lot of times don't know what happened. I've had them call me and say, Clint, if you just tell me what happened, or have someone tell me what happened, I would be so grateful. And that's one of my jobs. I may not take a case, but I will at least get some sense from Kathy what happened in the case, and then I can call the client and say, look, I don't think you have a case, or I'll send them a letter, say, look, I don't think you have a case because the case doesn't rise to the level of negligence, but here's what I think happened.
Okay, yeah, so the twofold thing here could be whether or not she was supervised when she went to the bathroom as she should have been, and how she was treated right afterward, even though you got to concede, I mean, falls happen in nursing homes with old people, and they do the best they can to watch. Now, there's certain circumstances, you know, if they're in line with their walker getting a bite to eat and they stumble, well, I don't know how someone can prevent that. I'm sorry, that's just going to happen. But if you're taking her somewhere where you had to get her there and then you leave her alone, that seems like more of a problem to me.
Surely. And of course they should have checked her for injuries after she fell.
Yeah.
That's one of the first things that a nurse does, is assess the patient for any injury. And then if there are injuries, then she reports it. The physician is notified, and she gets orders on how to treat that injury, whether an x-ray is needed, or whether we need wound care, or whether the doctor wants her to go to a hospital to be evaluated at the hospital.
You know,
she has to evaluate the patient for injury and then notify her nursing supervisor and the doctor of what has happened, so that the right decision can be made on how to take care of the patient.
In a case like this, Clint, too, I know that, you know, when you determine whether or not you take a case, part of it is damages. And initially when I heard his call and he said, well, her toenail was torn off, and I went, you know, that's awful, probably hurts, but no big deal. But then you realize what he's saying maybe the ultimate result was, which is as bad as it gets. This poor woman dies. So is it, you're going to try to make the link perhaps that whatever happened with this fall hastened her death? And can MRSA be linked to, you know, maybe the stress that would create a heart attack?
Yeah, I mean, that's one of the things that I would look into, is ultimately, was this the cause of death? Now, what Kathy can do is she can lay out basically the legal, the medical and nursing questions on which I can decide the legal question. If it's a case where Kathy says, I think that a case can be made that the infection ultimately led to cardiac arrest, then I would send the case to a medical expert, cardiologist, some other type of expert, or I'll ask Kathy, please find me a medical expert who can answer this question. And then the medical expert will provide that what we call causation link to determine whether or not the infection ultimately led to her death. And if it did, then you have a case of wrongful death.
Did we need to go to a break, Mary, did you say? Now, okay, well, hang on. I want to check one thing real quick. Robert, how old was she?
My mother was 99, and she
Wow.
had a clear mind. She knew everything that was going on up until this point. And of course, when we carried her to the emergency room, the doctors in the emergency room told me that this infection did cause the heart attack. Of course, it turned into gangrene, and my death certificate comes back. It's saying the infection, the MRSA infection, was the cause of death.
Yeah, and then a 99-year-old, you know, it could go, wow.
That is amazing that
Yeah.
someone lived that long. Sure seems like she should have gone a better way than that.
Yeah. Okay, listen, on that note, we'll take a break. When we come back, we've got more calls. Lisa, stay where you are. We'll get to your call. Robert, stick around. We'll get that phone number up for you. And if you want to ask a question, just like Robert did, this happened in September for him, and he lost his mother at age 99, and there may be questions about whether that was right or wrong. Join us with a question. We'll be back with more right after this.